Well, the philosophy of this fund here is that we offer a potentially good investment, but we also offer a vehicle for people to fight back against cancer. And we fight back in two ways, because the fund is investing in companies developing interesting products in the diagnosis, the early diagnosis and the treatment of cancer. And secondly, Candriam will donate 10% of the management fee to charities and research organizations who do early stage research on the fight against cancer. So in two ways, this fund, this vehicle, can help people fight back against this disease. Yeah, well, you have to say it is a global fund, obviously, so we will invest where we see innovation. In reality, we see it in many regions and in many countries. A lot of it is in the US, so the fund is around 60 to 65% invested in the US. And we also invest indeed in big and small companies. So again, we are agnostic to what kind of company is doing the innovation, as long as we see interesting products that potentially help patients. We are interested, and if we have upside, if the valuation gives upside, we will invest. So in reality, the fund is a mix between smaller, mid-caps, and eventually even very big companies, yes. No, they are not a risk. I mean, sometimes you hear people saying that the FDA would be unlogic or things or unpredictable. That's absolutely not true. I mean, the FDA is there to make sure that good and safe drugs get approved and that the public has access to those drugs, that the patients have access to those drugs. And they do it in a very rational and scientific way. So we have been investing in healthcare for 20 years now. So we have seen FDA decisions over many years, and I must say it's an institute that I respect a lot. So it's not a risk, it's just obviously a government institute that has to look at clinical data, has to assess the quality of drugs and make sure that only good and safe drugs make it to the public, and they do it well. So it's not a risk, it's a gatekeeper for quality.
Progress?
No, economic, I mean, the healthcare sector, you have to say, is not really dependent on the economy. So big pharma, big biotech companies, academic research institutes, they're not really depending on the economy. So you have to say, if you look at research sponsored by the National Institute of Health in the US, for instance, that's a government institute, they have budgets above $30 billion a year. And even in a recession, those budgets are not really cut. So they're reasonably stable, and they have even been growing over the years. So it's not a major risk. Also, big pharma companies or big biotech companies that are commercial, their sales are not depending on the economy. And their sales, obviously, if drugs get prescribed, it is because people have an illness and need to be treated. And that's not really depending on the economy. So this is a sector that is relatively less correlated with economic activity, economic data. So even there, it's not really a risk, no. The only risk I would see is that there is political interference on the level of drug prices in the US, and that's an ongoing debate. And that's obviously something that we have to watch, and we are watching this carefully. But economic data are absolutely nothing to worry about, no. Well, we carefully look at everything that's said publicly by either President Trump or, and more importantly, even the people he puts in place at important institutes like the Medicare and Medicaid, that's called CMS, or the Secretary of Health, Alex Azar, so it's the Minister of Health, let's say. So we carefully watch what those people are saying publicly and their actions that they're taking. And until now, I mean, there is a big difference to what Donald Trump is tweeting and what actually he's doing and what his government is doing also in healthcare. And I must say the actions that the government are taking, they're sensible. I mean, in our assessment, they're very sensible. Reimbursement and drug price setting in the US is a very complex system. And as any complex system, there are things that are less perfect. And here and there, it opens the door to exaggerated drug prices or the government eventually paying more than they should do. And I must say, with all the actions, the Trump government is trying to close those loopholes. So until now, what has been announced makes sense, and we see this as very rational. We don't see this as a frontal attack on drug pricing, because if you would decline prices of drugs massively, obviously research and innovation would also suffer. The main positions obviously are also big companies that are profitable, that are in commercial stage. So from a risk perspective, we will not make a small binary biotech company amongst the biggest positions in the fund, obviously. So the big positions are companies like Merck in the US, AstraZeneca. We had a big position in Daiichi Pharma in Japan, but the stock has been doing very well because they have a major partnership with AstraZeneca. So there we have been reducing our position somewhat. But the big positions are in relatively stable and obviously highly profitable companies. Well, the time horizon, like any equity investment, obviously you have to look more like a couple of years. And here also the development of drugs or products in general takes a long time. So you see, we analyze drugs sometimes from very early stage in their development. We like it, we start to invest. Then we slowly raise the position if more clinical data come out and the risk profile gets better. So you have to see this as a multi-year horizon, basically, yes. It's obviously, it's tough to really put a number on this because it creates expectations that also depend on what stock markets in general are doing, obviously. And you can somehow hope or predict that the company makes a certain profit, but how the stock market will value that profit depends on the general mood in the equity market. So it's tough to say the fund will do X%. But one could say healthcare in general has the tailwind of the aging of the population. Disease and certainly cancer comes with age. So with the global aging, somehow you can say the medical need will increase, consumption of medical products will increase. So that's a tailwind for investors. You could say, and it's a very tentative figure like this, that the top lines in this sector in general, they grow 5, 6, 7%. Bottom lines can grow even more because there is operational leverage. So you could hope for something like high single-digit increases on a yearly basis. But that's just a simple calculation. Obviously, it can be 15% one year and plus 3 the other year. So on average, I would think if I say something like high single-digit, it might be a good guesstimate, yes. Well, in general, obviously, we have very strict ESG criteria at Candriam in general for all our equity funds and surely also for this fund. So we have a big ESG team that gives extra input and they look at things, they analyze companies from specifically, obviously, an ESG angle. In my team, we will also look at all inconsistencies, like in clinical trials, things that would be unethical. I have to say we very rarely see that. So if we would see that, such a company obviously would not come in the fund or in any of our funds. In reality, it's very rare to see that. So it's true that pharma is maybe controversial, but in reality, if you look nowadays, it's more like in clinical trials, the way they are done, it's very ethical and consistent. So we rarely see things where we would say this is arguable, very rarely. But we obviously watch it very carefully, and then we also would engage because we have people that engage and are in voting at the annual meeting of a company. So we would vote against certain things if we see that there are inconsistencies, yes. But in general, I would say the behavior is quite okay, it's quite good. And you should not forget that in the end the pharma companies are developing drugs that are very useful in the end. So yes, it can be controversial. We all would like drugs to be very cheap. You have to see it in a way also that once the patent of a drug falls, the drug becomes very cheap. So drugs are protected by a patent, just like any innovation in any sector is protected by a patent. Once a patent falls after X years, the drug becomes generic, and you see then generic copies coming into the market, and then pricing goes down massively. So some drugs that were expensive in the 1990s, like cholesterol-lowering drugs, blood pressure-lowering drugs, depression drugs, they were very expensive then, and there was a lot of media attention to that. If you look now, they're all generic, and they cost very little. So 85% of prescriptions of drugs in the US is generic drugs, and they cost a couple of cents a pill. So in that sense, it's a question of you have to repay all the research, all the innovation over a high price over a certain period. And then after the patent falls, or the patents fall, because usually there are many patents, then the drug eventually becomes cheap to very cheap. And then you get a payback for a long time. So that's a bit how you should see it also. So yes, pharma might be controversial, but they do develop good products, and people with illnesses need those products, they need solutions. So in that sense, we're very much okay with this, and we rarely see really, let's say, questionable behavior. We very rarely see that, yeah. Although drug pricing, obviously, for good reasons, should be an open public discussion, yes.